Welcome to WOW, the Woman of the Week podcast series by PharmaVoice. This episode was made possible by a generous sponsorship from Calcium. For more information on Calcium, please visit calciumusa.com. In this episode, Taryn Grome, editor-in-chief of PharmaVoice magazine, meets with Rachel King, co-founder and CEO, Glycomimetics, Inc.
Rachel, I've been following your career for some time, and it's been fascinating to watch. You moved from the consultant arena at Bain & Company to the drug delivery company Alza to several startups, including Genetic Therapy, which was sold to Novartis, then to one of the country's leading venture capital firms, New Enterprise Associates, to then the founding of Glycomimetics. Can you talk us through your amazing journey and why you made some of the career decisions you did?
Sure. Well, and thank you. It's fun to look back and see what's happened over all those years. I do feel fortunate, I'd say, to have had opportunities to do work that I have found both meaningful and interesting and at many times fun. And so I do feel grateful as I look back. And it's funny, sometimes I think when you look back at a period of years like that, it can seem like it is a path that sort of in retrospect makes sense, although when you're in the midst of it, it's obviously not as clear. But I would say there are a couple of themes that have sort of that have guided me over the years. One is that I've really always loved biology, and I would say been driven by a desire somehow to connect with that in my work. Although I'm not a scientist, I'm not a physician, but I was one of those kids in high school that had a microscope and a dissecting kit at home. I was kind of a biology geek at that point. I thought I might have gone into science, so I've always had a love for that. So that was one theme, I would say. And the other is, for whatever reason, an attraction to an entrepreneurial setting. I would say both of those have kind of driven the decisions that I've made, that and then a desire to work with people that I've found I could learn from. And so just reflecting on a couple of the decisions, a first great opportunity was right out of college when I had the chance to go to Bain, which I think gave me a really great foundation in a lot of respects, an appreciation for an analytical approach to problem solving in business, and I would say confidence building, because there were a lot of smart people there that were great to work with. And I happened to be assigned at one point during my second year there to a case team that involved working with a biotechnology that was partnered with one of the Bain clients. And that was really, I'd say, the first time I had a chance to see that there was a way to kind of join these interests. And then went to business school, as you said, went to Alza, and then had another, I think, particularly important decision point and opportunity when I went to Genetic Therapy, which was a startup company at the time, and now we've had a resurgence, kind of a second wave of gene therapy in recent years, which has been really exciting to see. But GTI was actually the first company that had permission to do gene transfer experiments in humans in the United States some years ago, and I joined then as about the 12th employee and was able to be with that company through their VC raises, their going public, they're partnering with Sandoz, and then eventual sale to Novartis. So that was really foundational for me, too, to give me a chance to see sort of what it took to get a company through all of those things. And then from there into Novartis, as you said, to NEA and starting Glyco. So I'd say, each one of those has a particular story, which I'll go into if you like, but I think the general themes were a love of biology, an opportunity to work in an entrepreneurial setting, and a chance, to the extent you're able to know it in advance, but a chance to work with really great people.
Hearing your story, it sounds like there were a lot of pieces that perfectly formed this puzzle that led you to found Glyco. Is that a fair assessment?
I think in retrospect, yes. Prospectively, it's hard to see it that way, but in retrospect, I would say so. So by the time I founded Glyco, yes, I had worked in a number of different functions. I had been at a small company, been part of a large pharma company. I'd seen the financial side of things from being both at GTI and at Novartis, and thrown in some of the corporate strategy stuff from Bain and from business school. So by that time, I do feel I had a good breadth of experience to position me for the founding of Glyco, yes.
With that love of biology and with the technology that your company uses, which is really a differentiator in the drug development space, you've been in business for 15 years. What is your philosophy for the company, and where do you see it heading?
I guess starting with your comments on the science. So when we started the company, the vision was that we would be able to use this technology to make a whole new set of targets druggable. and that would be to use the knowledge of the functional carbohydrates, which are then beginning to be understood through a glycomics consortium that the NIH was supporting, to be able to use that information to then make mimetics, which would enable us for the first time to target those mechanisms. So that was kind of the technology vision. But then with any technology, then you need to ask yourselves, well, how do you make that relevant, right? Who cares, right? And how do you build a company that has an opportunity to potentially affect patients' lives, and in particular to see if there's a way to do it that could be transformational, ideally. And so we set out to do that, and it's actually been extremely gratifying to see how things have evolved, particularly in recent years. It's taken time to get to this point, and I think probably longer than any of us would have originally thought it was going to take, but to get to now a point now where we've got a phase 3 readout for the sickle cell program coming up, we hope within months through the Pfizer collaboration that we have, and then another program with breakthrough therapy entering phase 3. So in sickle cell in particular, I have to say it's been a fascinating journey. We had a technology that enabled us to target a particular mechanism, which was the selectins. This is a family of adhesion molecules. And we asked ourselves, where would that be relevant? And this is the critical question for any company, biotech or pharma. Where is that going to really make a difference? We looked at a number of criteria. We looked at some understanding of biological mechanisms, some animal models, and we identified sickle cell disease, in particular sickle cell crisis, as being an area where we thought the science said that the selectins played a critical role, and we felt that given the incredible need in that space, if we were successful with developing a drug, that it really would be transformational in the way patients were treated. And it was extremely difficult to finance that program. And here's where NEA and our board chairman came in and really supported us in ways that were just phenomenal. We were able to get through some great phase 2 data, the partnership with Pfizer. And just this year at ASH, actually, when we were there, it's fascinating to see how the selectins are accepted now as a target in sickle cell disease. Over the years, there's a number of things that have happened that have followed those original studies that have continued to build that case. But it's just fascinating to see how understanding of a biological target evolves, how a field evolves. And it's been exciting to be part of that. So I feel like what we've contributed to in sickle cell disease is really consistent with what the mission that we set out to do. And certainly we're waiting with great anticipation for the phase 3 data, which we're expecting mid-year. And we're similarly in AML, we have a vision there of looking mechanistically at a biological mechanism that has not previously been targeted in AML. And it's a very differentiated approach. We believe, as we did in sickle cell, that the basic science and the preclinical data really supports that. And so we've been very pleased with the data that we've generated so far, the breakthrough therapy designation that we got last year. And now we're carrying that one forward. So we'll see if that is also eventually something that people take for granted as a mechanism in AML. So basically the idea has been, apply the technology, try to find places where we could make a clinical transformation if successful, and drive the programs from there.
That is exciting, and congratulations to you and your team for moving these programs forward. My next question is around the partnership. So do you see partnership as your strategy going forward, or do you see the company being able to move maybe your next program forward by itself?
Well, I think partnership is always part of a strategic context for a company, right? I mean, it's one of the tools that you have in developing the programs and building your company. And when we were at the time of looking at partnering our sickle cell drug, we were at a very different stage of the company's life, and we were still private. Actually, it was a challenging time. We were in the phase 2 study, and we were short on cash. And we were facing a decision where we felt we could either try to partner the sickle cell program, bring in some cash, expand what we were doing in other areas, or pare down to a very, very small internal headcount and try to get over the line in sickle cell disease, see if we could make the money last and get there, which I wasn't sure if we could, but drop everything else. And so we decided strategically that we wanted to continue to build a company that was not just sickle cell, and we really felt that we needed the cash that a partnership could bring. we felt we had more value that we could create across a broader pipeline. So we decided to partner the sickle cell drug. It was in phase 2, so pre-phase 2 data. All we had was phase 1 data, so we had a good safety profile so far and some really strong preclinical data. And we took it out, and we ended up with multiple companies interested and multiple term sheets, but decided that the deal with Pfizer really was the best for the company. That has turned out to be, I think, a really excellent deal. Because it was done at the time that it was done, and with the company at the stage where we were, we have a royalty-based deal, not a deal where we have market participation. And again, it was a good deal for us at the time. Now we're in a different situation. With our second program, the one that's just entering phase 3, we now are well-financed to get that over the phase 3 line ourselves. And we've also got a number of collaborative consortia in place now with the National Cancer Institute here and with another group in Europe, because the KOL interest has been so high. So we've got a great, I think, comprehensive development program for that already in place and financed. So it's a very different situation to contemplate partnering in that setting, and we don't need to partner that program. I think if we were to partner it, it would be on very different terms than we did for Pfizer and sickle cell. And I think it's more likely that we might partner something that's at an earlier stage. We've got a lot of really interesting earlier stage programs that could potentially be partnerable, and now maybe enough credibility around the technology that maybe we could get an early stage partnership. So we view it differently. It's not a financing vehicle for us now as it was in the earlier days, and it would be much more strategic. And we're in a different position that gives us more flexibility as we think about what we would want to get out of that.
It's a fascinating story, and I do agree. I think that when you look at the different stages of the development of the technology and the different decisions you had to make, there had to be some sleepless nights there, let's face it, right?
Oh, my gosh, yes. I think about the company, and sometimes tell the story. If you look at the history of the company kind of from the outside, which everybody does, right? I mean, as we look at other companies, other people's companies, it could look like a straight path. You got the VC money, the partnership, the IPO, the expansion of the pipeline, et cetera, et cetera. But it's been an incredible roller coaster. That's the truth. And at many turns, there are many places where things could have gone awry and things could have worked out really, really differently. So yes, there were certainly some sleepless nights.
Well, it then begs the question, as one of the few CEOs in the biotech world, how do you celebrate those successes?
Within the company, we'll have company meetings, we'll have company gatherings where we highlight successes. I have to say, I personally, I find that when I get to a milestone where, like, for example, when we've got the breakthrough therapy designation, we went from the breakthrough therapy designation immediately to a financing. So it was great success, and then an exhausting few days of trying to get a financing done, which was done and which was successful. And then we caught our breath and said, okay, phew, great job on both of those. I won't say we have big bashes. We don't do that. I think we're more quiet celebrators, because I think we recognize that getting an accomplishment, opens the door to more opportunity and still a lot to be done. So it's a short-lived celebration, I want to say.
That's a shame, but I understand it. And I don't know that I meant necessarily in terms of big bashes, but, gauging success for yourself and gauging success for the company, it's important to recognize those milestones.
Absolutely. We try to engage and communicate and celebrate for our whole team here and recognize that the contributions that everyone's made. Maybe I want to tell a story, and then I'll speak to the core values of the company. One of the times when we had big challenges was around the time the company tried to go public. It was in the end of 2013, and the markets had opened up, and we got our sickle cell data, phase 2 data in the spring. We had to go through some Pfizer governance issues to ensure they were going to go forward. Then based on that, we filed our S1, and we rushed to try to get the company public. And we ended up going on our roadshow in, I think, early November of 2013, just at the time that for the first time that year, the market was turning south. We were heading into trying to price our deal when for the first time that year, the BTK started to trade down. So we had to pull the IPO. And we were the first of probably 7 or 8 companies that had to pull our IPO at the end of the year, and it was really tough. We had gone through all the work. We actually had gone on the road show, so it was public that we were out there. And so came back to the company and had to, have the company meeting where we said, we tried and we didn't get out. And we were trying to figure out what our alternatives were going to be. Then at the end of that year, we had our presentation at ASH, and we actually were chosen for Best of ASH for our Phase 2 data. And we had an end of Phase 2 meeting with the FDA, and we circled back. We decided during December to circle back to the investors, some of the people we'd seen on the IPO, to try to tell them, there's new news. We got Best of ASH. We've had the end of Phase 2. Things are, it's great data. We want you to reconsider, basically. The bankers had told us, that was unorthodox, but they said, you can do it. You can call them directly, which we did. And then in the first week of January, the arrangement was the bankers would circle back to them. If we got an anchor order, then we'd come to New York and we'd market for a couple days by phone, and we'd try to get the IPO done before J.P. Morgan, which was our goal, because then we'd be ahead of the pack for the year. And so we did get an anchor order. We got the call from the bankers. We went to New York and were able to get the IPO done. So it was kind of pulling a rabbit out of a hat, and I think speaks to one of the core values of the company, which is perseverance. We went through an exercise here actually some years ago where we asked a group of people at the company, and I was not on the team myself, but asked a group of people to see if they could articulate for the company what are our core values here as a matter of both description and aspiration, right? What do we think our values are, and what do we also aspire to live? They came up with 4 of them, and one of them is perseverance, another one is passion, and integrity and teamwork. And I value the words that they came up with, but I also really value the way that they describe them, and that's up on our website. But that's a story as a way of sort of giving insight into how we work and how I hope we feel around the company as we do these very difficult things.
Rachel, thank you so much for sharing. That's a fascinating story, and I think it demonstrates that biotech is not for the faint of heart. So you really do have to have perseverance, and you have to have the teamwork of everybody involved. I'd like to switch tactics just for a second and talk a little bit about your experience as chair of BIO.
Sure. I just think BIO is a fabulous organization. I mean, I can't say enough great things about it. It's a place where colleagues gather and not only advocate for policy that matters, I think, for the whole industry, but also those of us who are really involved, I think, find it a great community to be a part of. And I think Jim Greenwood has been a wonderful leader for the organization in the years that he's been there. I think BIO is really, in an interesting way, uniquely positioned to speak to matters of innovation that apply not only to us but also to the big pharma companies. So I think there's a lot of interest and engagement from the broader policy world in biotechnology, where I think people really recognize and appreciate the truly transformational things that our companies are trying to do, and the impact that, if they're successful, the impact that they'll have on patients. As you know, I've worked on the pharma side of things too. When I was at Novartis, and actually for a number of years ran the Washington office for Novartis, so I feel also very sympathetic and supportive to what the pharma companies are doing. I think pharma companies also at their core, are striving to be innovative and to make difference in people's lives. But I think on the biotech side, because we're so strapped for cash, because we're so lean, we have to be entrepreneurial. I think we can really tell the innovation story in a way that's clear and that really resonates with people. So I have just loved being a part of that, and I believe very strongly in what BIO is trying to do. And a chance to be in the leadership there was great. I was the board chair of the emerging company section, which is one of the kind of divisions of the board there, and then eventually became chair of the full board. And I still serve on the executive committee there, and I really enjoy it now under John Maraganori's leadership from Alnylam. It's been a great experience. We did the issues that BIO addresses. I think, while there may be individual specific pieces of legislation at any given time, and the politics of a given moment might change or have a particular focus, I think that some of the themes have been consistent over the years. And also, even legislation, when it does get passed, often takes years. So I was chair for 2 years, but the things that I was working on weren't only limited to those 2 years. So, for example, at that time we were working on the early years of what became the 21st Century Cures Act. That was an important piece of legislation that was bipartisan that passed, that I think has laid foundations for some important support of the industry. We had a PDUFA renegotiation there. We always have issues around capital formation, how to create an environment where companies can more easily finance. Also at that time, we're really beginning to focus on messaging around the value story that biotech brings. So they're, again, the kind of policy issues that go beyond any one chair's term, but I think really underlie what's been the approach to bio over many years to try to support innovation in the industry.
It's exciting stuff.
It's really a team effort. The bio staff is wonderful. As I said, I think Jim Greenwood's leadership has been strong. And then the board members, which interestingly contribute or consist not only of smaller companies. I would say maybe 90% of bio's membership are companies that are considered emerging companies, so pre-revenue companies. That's our industry. Pre-revenue companies that have less than 500 employees, many venture-funded or early-stage public companies. That's the bulk of biotech. And then beyond that, though, we do have membership from the big pharma companies that also have really important things to contribute, as they sit around the table, and expose some of the earlier biotech companies to some of the issues that we'll need to worry about around reimbursement, for example. It's a great industry partnership, as it were, to really try to get policies that support innovation. So, yeah, I can't say enough great things about bio.
That's what, and with those emerging companies, I would imagine you are seeing some of the most cutting-edge technologies and some of the most innovative thinking in the industry.
Oh, it's wonderful. To meet the other CEOs at the board meetings and hear what they're dealing with. It's a great opportunity to network and to share experiences that we have, and to share advice and stories. That's great. And from the perspective that you just mentioned, in terms of the technologies that are out there, it's fascinating to hear. I mean, one of the things that's really hot right now, of course, is genome editing, and bio does have a genome editing working group as an example, and members of the board who are from that segment. And so, yeah, I think we're well positioned to hear about those technologies and hopefully to be thinking proactively about what policies are going to need to be in place to responsibly develop them.
Exactly. You also serve on a number of other boards, including Novavax and the University of Maryland's Biopark, where I would again imagine you're exposed to a number of different cutting-edge technologies and innovations. We know from the statistics out there that women have a difficult time securing board positions. How did you find your seat on the board? So
in both of those cases, I was approached by people that I knew, and I think that speaks to the importance of networking. And each of those is different, of course. And each of those is really exciting for the respective things that they're doing. Novavax is a really exciting vaccine company here in Maryland, and then the University of Maryland Biopark is a really exciting organization that's developing a biotech center, as it were, a series of buildings in a biotech center in a part of Baltimore that has had some tough economic times, and I think is really helping to transform the neighborhood. So very different. So I have also been approached over the years by headhunters, by different ways of networking, I guess. But in those specific examples, it's been people that I knew. So I think that speaks to the importance of people really continuing to build their professional networks as their careers develop.
Sure, it's that strategic relationship building that can be the cornerstone of this kind of experience.
Mm-hmm. Yes, yeah. And not just strategic. I mean, strategic relationship building, I think, sounds very planned out. It's hard to plan those things out. I think I guess I would say what's helpful is getting to know people that you respect and admire, and continuing to build relationships with those people over the years. And eventually, I think, ultimately, that's what bears that kind of fruit.
Sure, it's that nurturing and keeping that network alive as you move across different sectors and across different industries as well as companies. What are some of the lessons you learned along the way that might benefit other women who aspire to reach the C-suites?
That's a really hard question, actually, because I think it's speaks to so many things. I mean, it's, I think a lot of people say to follow your passion, and I feel that's a hard thing to actually do in life, because I think passions emerge, or a sense of vocation, I think, emerges. At least that's been my experience. It's not. I think for some people, it may be that one decides early in life, I want to do a certain thing, and then there's a path to go after that. If you want to be a physician, for example, there's a path, a long path, you need to follow. I would say, for much of my life, had the desire that I would be able to run some kind of entrepreneurial company. I have wanted to do that, but I think it's a series of really small steps. I mean, I guess if you can follow what you enjoy fundamentally, if you're able to follow what you enjoy, that's number one, and do it in a way that engages you as much as you possibly can with the best possible people that you can, because it's really hard to know that a particular opportunity is going to lead to a particular another opportunity. What has been my experience is through people that I've known, next opportunities have come about, and we were just talking about this a moment ago with respect to boards. It's how can you connect yourself, and how can you engage with, over the course of your career, with the best possible people who can teach you. That's one thing. I would say another is to build, as you're able, an expertise of some kind, in other words, functional expertise of some kind, complemented by some experience of breadth. So that sounds like a contradiction. I mean, I came up through the business side of things. Other people might come up through research side or clinical development or whatever. So, you have a functional expertise. In my case, I started doing licensing and business development, but then was able to kind of broaden that through other experiences, so that eventually I was able to, to be able to run a company that has a diverse set of functions. So I would say that's another thing. Try to build your functional experience as well as some kind of breadth. And I would also say be willing to take some risks. Although risk is another one that's difficult to gauge. At one point I was at Genetic Therapy, and I hired somebody who came to the company from a major pharma company. I think she was coming from Glaxo before they merged with SmithKline. And so she came from Glaxo and took a job with us, and told me that some of her friends were saying, "Why are you taking such a risky step, as to go do that?" But some months later, Glaxo and SmithKline merged, and as she told the story, if there were 10 people in one department in one company and 10 in the other department, the new company was going to have 15, not 20, and everybody had to reapply for their old jobs. So you may think you're in an unrisky situation, for example, or stable situation, but you may actually not be. So perception of risk is complex to gauge. But I think to take something that sometimes you might feel is a risk, I think, is reasonable. The other thing I would throw in here is I'm married and have children, and I was fortunate also for about 5 years when my kids were young to work for 4 days a week. And I was able to negotiate that with my boss, and that gave me that extra day at home, which really helped at that stage of life. So there's also an element of balance that somehow can be worked in, because you can't do everything at once, but over the course of many years, perhaps you can do a lot. So those are some thoughts.
Those are excellent thoughts, and I think you just touched on something very important, is that work-life balance, and we hear that so often when we talk to women CEOs. And how do you maintain that? How do you achieve it? And I think it's kudos to you for having the gumption to go to your boss and negotiate that. I don't know that enough women actually speak up for those kinds of things, so that it allows them to move their career forward at the same time as to have a family.
Yeah, and I think you can't do that if you're going in and taking a brand new job and nobody knows who you are. That's the other thing, which speaks to relationships. If somebody's in a job and has demonstrated capabilities, then an organization, I think, is maybe more willing to accommodate that, because we know I think companies recognize more and more how important it is to have the right people, and how valuable it is to have the right people, and how important it is to keep them if you can. So I do feel maybe now more so than when I was earlier in my career, perhaps organizations are willing to do that. I'm really grateful that my boss at the time, who's the board chair of our company now, was willing to give me that flexibility. That was really important. It was really important. So to be able to ask for that. And I think as organizations, we have to find a balance between driving to achieve organizational goals and, hoping that we can do that in a way that people can have meaningful outside of work lives. Because it's not sustainable to be running full throttle at work all the time. It's just not. So I hope as organizations we can also, find ways to at least be open to helping people with that balance. It's tough.
It definitely is tough, and we're seeing that pendulum swing. We're looking at how millennials are changing the workforce and how that balance needs to be between, as we call them, the seasoned professionals and the millennials who come in with a different viewpoint as to what work means.
Sure. I mean, in fact, I think that's a great question. What is the purpose of work, right? And what is the meaning of work? And I think a lot of people are taking a perspective now that if we're able to think of work not only as a way of providing financial support to our families and ourselves, but also as something that provides meaning, right? And if we're able to think about work more broadly, then we also ask more of it. I think it's good that as a society we're asking more of it in terms of asking for it to be meaningful to us as well as just a way of paying the bills. I think that's important.
Right, and having leaders like yourself who act as role models.
Well, who try.
Well, that's the step in the right direction, right?
Yeah.
Finally, I think we'll end with this question: Is there one piece of advice that you would give to your younger self?
I might advise myself not to be so stressed out at certain times of my life. Maybe to incorporate, a little bit more of those things that would have maybe brought me to less stress, enjoy things a bit, and recognize, I think, and I do try to do this now, to reflect on the good that we have in the moment, because I think that we're striving to accomplish things in our companies that take a long time, lots of money and a long time, and so I think you can engage with your career always kind of thinking about something that's far off that in a few years we'll get to. And I think it's important to recognize in the moment what we have in terms of the value of the work that we're doing, the colleagues that we have. Actually, my husband, who often does, he made a comment recently that I think was helpful in this regard. I was talking about something that's many years off, and I said, I hope it works out. And he said, well, thinking about everything that's happened at the company so far, in the sense of the way we've built the company, the things we've accomplished so far, the community that we have at work, the meaningful work that we're doing. He said, it seems to me like things already have worked out pretty well. Not that we're finished. I don't think we're finished, but I do feel a real sense of gratitude for what we have so far. And I think, if I were to give myself advice to my younger self, as you said, I think I would say to appreciate the journey as much as the arrival.
That's perfect. I can't thank you enough for being so open and transparent and for sharing your stories with us.
Great. Oh, well, thanks for inviting me. I really appreciate being your guest for the podcast.
Thank you for listening to this episode of WOW, the Woman of the Week podcast series. And thanks again to Calcium for sponsoring this program. For more information on Calcium, please visit calciumusa.com. We also encourage you to listen to additional episodes at pharmavoice.com/wow. This 2019 program is copyrighted by PharmaLinks LLC.